I'm Elizabeth Griffiths. I'm one of the leukemia physicians here at Roswell Park. My focus is on hematologic malignancies. So myelodysplastic syndromes and other hematologic malignancies are relatively rare. In terms of total numbers of cases of these types of diagnoses, nationally and internationally, these represent unusual cancers. By contrast with, say, for example, things like lung cancer, breast cancer, prostate cancer. As a result, it can sometimes be a challenge to make an effective and appropriate diagnosis. One of the unique features that we have here at Roswell Park is we have in-house pathology, molecular diagnostics, and cytogenetics. And I get the results from the doctors who are doing these assessments with very rapid turnaround. We also have in-house flow cytometry, which is among the best in the world, and this allows us the opportunity to create a comprehensive diagnosis for patients who may have a challenging bone marrow failure disorder. There are nuances to treating patients that include when to treat and when to watch. Because we see a large volume of patients, we're very familiar with the state of the art in terms of what's appropriate for treatment. And we can offer people the opportunity for potentially curative therapies like allogeneic transplant to an older age category. And so clinical trials are designed to try and add on that backbone to try and improve long-term survival, and for people who are not transplant eligible to offer a potential for longer survival and perhaps even for cure. So one of the very unique things that we have here that is not available to many of our colleagues who are excellent doctors in the community is we have the availability of an in-house blood bank and aggressive transfusion support. And we also have a nursing staff and a support staff that are uniquely familiar with our patients with hematologic malignancy. Oftentimes, it's actually not the doctors that are unique and special. I would argue that it's the team approach that we have. People who have expensive medications that are needed for prevention of infection. I have a team of people who work behind the scenes to get authorization for medications and to provide help if the copays are very high. In private practice, those resources just aren't available to the same extent. And so sometimes I often see patients as a second opinion who go back and see their doctors in the community, and we're able to help them to make sure that their patients have access to the same kinds of support that our patients have.